Welcome to the Friends of NPACE podcast, brought to you by Haleon. As a leading global consumer healthcare company, Haleon is dedicated to delivering better everyday health with humanity. Known for trusted brands like Advil, Excedrin, and Voltaren, Haleon leverages science, innovation, and human understanding. Haleon is proud to collaborate with NPACE to educate healthcare professionals about our pain portfolio and the latest healthcare information. For more information, visit www.haleonhealthpartners.com.
Welcome, everybody. I'm Terry Schmidt, the Executive Director of NPACE, and we are doing a Friends of NPACE podcast. I, of course, as you know, is a practicing family nurse practitioner, and I am so excited to introduce today's guest. We are here in Chicago at our pharmacology conference, and we get our keynote speaker to join us here. I'm here with Amy Seipel. She's a national speaker and author on healthcare issues that impact older adults and the empowerment of healthcare givers. She actually talked here on leadership as our keynote and communication, and that was just beautiful. She's served the primary care needs of older adults for over 25 years under her leadership. As president of the Kansas Advanced Practice Nurses Association, Kansas became the 26th state to pass full practice authority for APRNs in 2022. That was a lot of hard work. So I appreciate you doing that. We're grateful. Kansas people are grateful as well. A great access point.
We had a great team working on that.
I love that so much. And you serve as the chair for the Kansas Board of Adult Care Home Executives, and you're a TEDx speaker. And you live in Kansas, and you've been married to the man of your dreams for over 33 years.
I am so fortunate. He is not selfish, so he's easy to be married to.
Oh,
yes.
I love that so much.
Such a difference.
We get to meet him here.
Yes.
He came up and took some pictures, and I love that. Thank you for coming and being here with us. Yeah, so we're going to talk about something really important. We're going to talk about protecting your license.
Yes.
As a nurse practitioner, which you had said to me, I don't think we cover this enough in school. I don't think people are aware. And I completely agree. So I'm so excited that you just talk a little bit about this. So I have a general question in season 2 that I've been asking all of my healthcare people.
Okay.
How did you become a healthcare person, a profession, nurse, then nurse practitioner? What was that journey like?
Sure. I really enjoy problem solving, logic, biology. And I have a God-given compassion for people and a heart for those in need. So nursing was just a natural fit for me. So I started out in peds and then did pediatric oncology, and then I realized if I could probably make a bigger impact by going back to school. So I went back to grad school, and then I guess it was about 7 years later, I became a nurse practitioner and started out in family practice, and then really gravitated towards the complexity of older adult care, just multiple system issues. I just really enjoyed that. So ended up in the gerontology world. So
wow. I mean, one end of the age spectrum to the other in your career.
Yes.
How did you end up in leadership, NP leadership?
Oh, I enjoy studying people, and I guess God has really moved me into lots of leadership positions, through just our church. And then of course, with just your family. And then I taught parenting classes and marriage classes just in the private sector.
Mm-hmm.
And then when I moved into academia, I moved up in that area. I've been asked by 3 different governors to serve on different task forces. And so I've always volunteered for that, and just sort of naturally moved into those positions and realized that once again, I can make a bigger impact if I can influence others than just directly providing the care of myself. So
yeah, it's interesting how those things kind of come up, and that you don't go looking for them, but they just kind of happen.
Yes, they happen.
Yes. And then you enter in. They always change me. Leadership positions more than sure I make as much impact as they impact me.
No, that's probably true.
Sometimes. I appreciate that.
Yes.
All right. So I do want to talk about protecting license. How did you get interested first in this topic, Era? Like, how did it come to you? And
well, first of all, let me say too, I'm not an attorney, and this isn't medical advice.
Right.
I have just I did a deep dive into looking at different nurse practice acts. I've talked to people who have faced board discipline and also people on the board. And I've created a presentation and I've been speaking on this. And I know that nurses they're not aware of the risk of board discipline. And what I have found is really shocking. So a lot of nurse practitioners worry about being sued. I mean, we worry
Right.
about that, right?
Right.
And when I looked at the literature, there was one study that showed, but in the past, like the 4-year time span, there were about 850 cases of malpractice suits that involved nurses, and it didn't differentiate NPs. And so what are you looking at? Less than 250 a year, but there are 18,000 board discipline cases that
Wow.
come against nurses, according to the National Practitioner Database in just 2021 alone.
Oh my gosh.
So this, people don't recognize that board discipline can have devastating consequences on your personal and professional life.
Yeah. So we talked, there's 18,000 of them, but what kind of complaints are generally filed against advanced
Great
practice?
question. Oh, the majority of the complaints are what you would expect, med errors, patient falls, patient neglect, sort of things. Unprofessional conduct is a very big one. And I'll kind of circle back probably to unprofessional conduct later, but it is a very broad, all-encompassing topic that many things fall under.
Oh,
So
okay.
people need to be aware that you can be labeled with unprofessional conduct if you sexually assault a patient or if you're late renewing your license.
Really?
Yes,
Late license renewal.
yes, a late license renewal. Let me tell you about a case. So
Okay.
this will really highlight where, most of the time, keep in mind, the role of the board of nursing is to protect the public. And I'm thankful that they're
Sure.
there. So they are there to protect the public from unethical and incompetent nurses, and we want that, right?
Absolutely.
But you can also receive board discipline for like maybe a DUI, or you didn't pay child support or alimony.
Right.
That can all come under the board, under your license. Again, discipline against your license too. So I received a call from a psychiatric nurse practitioner in Kansas. This was just a couple of weeks ago. And she called me and told me that when she renewed her license, she clicked the wrong box. So in Kansas, they ask you, do you want to renew your RN or your APRN license? Well, you have to renew both. And you
Right.
can't do it at the same time. So you click the RN and then you go through this series of questions and you pay a due. And then you come back to the homepage and then you click the APRN, you answer the same questions and you pay a due. I mean, so that's the process. Well, when she came back to the homepage, she clicked RN again. So she accidentally clicked RN twice,
Okay.
but she paid 2 fees in that process.
And she thought she was done.
And she thought she was done. And she's been a psych NP for over 30 years. So then she receives a call from the pharmacist a couple months later saying, you don't have a license anymore. We can't fill scripts. So she calls the board of nursing and they said, oh, we know you made a clerical error. We see that here, but we don't call or intervene on clerical errors. You are not licensed and you cannot see patients. And she has her own practice. She has her own practice. So she said, what do I do with all of my clients? And they said, send them to the ER if you have to, but you can't see clients until we get this resolved.
Okay.
So then they send her a consent order. So then if it's a minor offense, you might be asked to sign a consent agreement. And a consent agreement is like a guilty plea. So you're saying, I am guilty of this, I'll sign this. And they said, you need to sign this consent agreement or it will be worse for you. If you challenge, the discipline, it'll be worse for you. So you need to sign the consent. So she signed the consent agreement. Well, what she didn't realize is that when you are disciplined by the board, this is a public process. And so you are put on databases. You're put on 3 databases in perpetuity for life.
Really?
You're going to be on the National Practitioner Database. You'll be on Nurses.
Yes.
And in Kansas, then you're on the website. So you go to the Kansas or the KSB and Kansas State Board of Nursing, and it will list all discipline cases. Plus, she's in the newsletter.
Oh, yes, that goes out.
She's in the news, so she's on like 4 different. So now Blue Cross and Blue Shield drops her. So, and then her malpractice insurance company calls her and says, we won't renew your malpractice. she was able to negotiate with malpractice, and she got 3 times, but she has to pay 3 times the rate. And I don't know if she'll be able to stay in practice. And that is for clicking a wrong box. Yeah, her CVs were all up to date.
Filled in all the stuff correctly.
She's never been sued. She's never been.
And the board knew that
They
it was
knew it was a
clerical.
clerical error. Yes, so that is the reality. And that's what I'm finding. It's, it can have devastating impacts. And yeah, her husband had a stroke, and so he was an NP. They had opened the practice together. Now she's caring for him.
Oh my goodness.
She's in a really bad position. But this happens. So
Well, I'm sure there's more stories.
there are
like
more
that,
stories.
but I
can
can't.
tell you a lot. Yes.
Okay, so I mean, I was going to ask, can an NP be disciplined by the Board of Nursing for issues that don't involve patient care? But clearly the
Yes.
answer is
Yes.
yes.
Even controversial social media post, even if you are thought to be bullying somebody online, that so anyone can file a complaint against you. So it could be a patient, or it could be somebody online or elsewhere. In some states, those complaints are anonymous, and in others, they're not. So in Kansas, I believe it's anonymous. And so you may not know who filed the complaint against you.
Okay.
But yes.
What does that process look like? I'm going to go down a little different
Yes.
path. So
Yes.
anyone can file a complaint with the
Yes.
board, then what happens after that?
So, right, so the complaint is filed, then there is an investigation. So there are people within the board that are on the investigation committee. And these people, I don't even know if they have to be nurses. So some people, these are the bureaucrats within the board. So they're not the board members themselves.
Okay,
They're the office.
they're like the staff, right?
Yes,
They do
yes, yeah.
investigation.
So they're going to do an investigation into you, and you may not know that you're being investigated. So you may be contacted and you may not be. But that's what a mistake I think a lot of people make, is when they get a call from the Board of Nursing, they don't understand that this is like a prosecutor calling you. And so they're pretty liberal in their
Yeah, giving
conversation.
information,
Yeah,
right?
you need information. I'm a
Absolutely.
nurse, I give you information.
It's right.
Yes, yes, they don't understand what's happening. So then there's an investigation. Then you have to determine if there's jurisdiction. So that'll go, so in Kansas, and I think it's this way in most states, it'll go to the Attorney General's office, and they determine if they do have jurisdiction. So for example, there was a nurse in Kansas who she was involved in a social media post that was controversial. So somebody contacted the Board of Nursing. The Board of Nursing decided to take action against her. They went to the Attorney General's office. The Attorney General's office said, no, you don't have jurisdiction. So you cannot take action against her.
Okay.
So they may decide that they can't, but the board writes their own rules and regs. So they really kind of get to decide.
And in every state, it's a little bit different.
Yes, in different states, it's a little different. Yes. So and then in some states, like the legislature may have oversight in them, but like in our state, the legislature has no oversight really over them. It's the governor's office has appoints the board members, and I think she has some oversight. So then if it's decided that they have jurisdiction, then they will come with either like that consent agreement, which is basically just a guilty plea.
Okay.
That, and if you sign that, then you don't go to a hearing. It's you just accept whatever reprimand they give you. Maybe it's a fine or probation or whatever. If you decide to go to hearing, then you don't sign the consent agreement, and then a summary judgment will come against you. And so they'll fill out, a summary judgment, and then you can request a hearing. Now, the hearing may not go before the whole board. It may go for just a few people, or it may go like in Kansas, it's a single hearing officer who is an attorney who's who works with the board. So this attorney who works with the board becomes the hearing officer. So then you present your case in front of this one person.
Who's already affiliated.
Who's already affiliated with the board. Yes. And then they decide what will happen to you. And then that judgment is public.
Right.
In perpetuity. I mean, even after you die, it is still on their databases. Yes.
Interesting. All right, so we want to protect our license. All right, so I asked that question. I'm so great. What are the steps in the Board of Nursing investigation process?
Yes.
So knowing exactly everything you just said. So
Yes.
what do we do to protect our license? What's that look like?
Right, right. You need to know your Nurse Practice Act.
Okay,
Know your Nurse Practice Act is very important. I mean, I think that most of the people that listen to your podcast are ethical and are competent people. So I mean, they probably think this is never going to apply to me. I'm telling you, it can happen to you.
I mean, almost 20,000 people a year. There's only 4 million nurses in the US. If that's yearly count, that's
It's
a
a
lot.
lot of discipline cases.
Yeah.
It's a lot of discipline cases. So I would say if you are contacted too by the board,
Sorry, Ryan.
be cautious in your response. So you don't
Okay.
want to ignore them. Don't ignore them because that will result in further discipline.
Okay.
But be very conscientious in your response. Be guarded. Think about them as a prosecutor. Just, think of them like I am talking to an attorney right now that
Okay.
may prosecute me, sort
Do
of thing.
they usually like email you instead
Yes.
of? Okay.
Well,
all right.
they may email you. I mean, I don't know if I assume they could call too. I haven't had anybody tell me that they asked for the call. I've had people say that they got a call, so I don't know
Okay.
on that,
Okay.
but I know that they will email you, but be guarded in your responses. Don't be flippant in that. Another thing is most of your malpractice providers do have a license protection part of that policy.
Okay.
So and people don't realize that,
Okay,
but
so
most
look
of
at
them
your
have that.
malpractice.
So look at your malpractice. If you're contacted by the Board of Nursing, I would call my malpractice insurance provider first to see if they have a license protection. And then you may want to talk through your attorney, or, I mean, if you talk to them yourself, I mean, I think most nurse practitioners are pretty disciplined in what they say.
Yeah.
Just don't be too liberal with your conversations,
Okay.
answer the questions and be sort of succinct in that process.
Okay.
But yes, I mean, it can happen to anybody. And I gotta tell you, so I'll just be totally forthcoming here. In 33 years, of course, I've never been sued. I've never been disciplined or anything. Last year, my husband was diagnosed with metastatic cancer.
Oh, I'm so sorry.
Yeah, I mean, he's doing well, but I was terrified. Firemen have sometimes a pretty poor course with that.
Right.
They're more at risk for it.
Yeah.
And so I was just, my whole world stopped, just focusing on his treatment plan and getting through the surgery and what's next. And it was just a crazy time. And for the first time in 32 years, it was last year, the first time in 32 years, I just forgot to renew my license. Now, my malpractice was up to date because, of course, I speak at conferences all over the nation. So I'm at all these, I mean, I've got tons of education. That's never a problem. So I submitted my malpractice information, which has never lapsed, and all my education and said it was all done prior to the deadline, but I am late paying you. So the only thing I was deficient in is paying them. I am late paying you. And so let me know if I owe you a late fee or something. And this is before I knew this content, and I thought that was it. That is not it. It's not even close.
Oh, gosh.
Yes. So I am being charged. And so that nurse practitioner I told you about, they clicked the wrong box. She's charged with unprofessional conduct
Oh, my goodness.
for clicking the wrong box. I am charged with unprofessional conduct
Oh, my gosh.
for practicing without a license. And so I did not sign the consent agreement. The
Good.
summary judgment has come against me. Now I have to go for it before a hearing, and I don't know what they will do. I mean, what's on the table, they could just find me and put me on 3 databases in their newsletter, which I don't know what that'll do to me professionally. They could revoke my license. They could suspend my license. I mean, they could take it completely away. But they have acknowledged the only thing I did wrong was pay late. And I was just, it's the first time in my life
Right.
that's just renewing my license wasn't on my radar. Yes, so that's what I'm saying. This could happen to anyone.
Yeah.
And so it's, yeah, but I have an attorney, $450 an hour, but
Yep.
yeah,
That's
they
the
are
going.
expensive. They are expensive, but fortunately, my malpractice insurance does offer some license protection to help with that, but
I mean, let's emphasize that malpractice insurance. a little
yes.
bit. I just think it's a really important thing for people to carry. And I know
It
the
is.
rates have gone up and sometimes people don't think the expense is worth it, but gosh.
Even for, yeah, license protection is, you're a lot more likely to face a discipline case than you are a malpractice case. You are a lot more likely. And I never imagined I would face a discipline case because I'm a very ethical and astute practitioner.
Yeah.
But it happened to me, it happened to that NP that called me 2 weeks ago for clicking the wrong box, and it can happen to you.
I appreciate you sharing
Oh,
your story.
sure.
I'm so sorry. I mean, I can't imagine the life circumstances that were surrounding all this, and just to add that other layer of something to
Yes.
the mix. Ugh.
Yeah, it's just the way it goes. But if I can help other providers understand this, I mean, that would be my goal, is I just want to make other nurse practitioners, other nurses aware of the risks so that they can try to be very conscientious and cognizant. When they contacted me, I was not guarded in what I was saying. I didn't hire an attorney right away. I never
Here's the
imagined.
information. Yes,
Yes.
here's what's going on.
Yes, yes, yes. What's my late fee?
Right,
Yes.
right.
Yeah, I had
It's
no
not like
idea what I
membership
was
dues.
walking into. No, it is not. It's not at all. So anyway, I just want to make sure other people are aware so they
Okay.
don't make some of the mistakes that I've made.
I appreciate you sharing that.
Yes.
So where are the resources? Where can we find what?
Yes, so if I was going to encourage you, if you were contacted by the Board of Nursing, go back and read the Nurse Practice Act in your state before you contact them. So hopefully when they email you, you'll have an idea of what they're talking to you about.
Okay.
But you need to understand what that is.
Mhm.
Contact your malpractice provider and
Okay.
get an attorney to walk you through this process. And you may contact others. Like now I have people contacting me. When I was the president of the Kansas City Practice Nurses Association, people would call me with questions like this. And
Okay.
unfortunately, I didn't know as much then as I know now, but contact other people too. And
Okay.
and I want to tell you too that it doesn't define you. This doesn't define you. So, that NP that called me a couple of weeks ago, I mean, sobbing. I mean,
Sure.
this is so hard. This is
Right.
so hard. And she said, I've dedicated my life to helping others. And I said, and you're a great NP. You've done a lot of wonderful things for a lot of people for 30 years, and we need you. The state needs you. And this one event does not define who you are. And we don't want people to leave practice because they feel shamed or whatever.
Right.
I will say too, it is different if it's a diversion case. So
Correct.
if
Right.
if you have alcohol or drug addictions, then you are not publicly disciplined. So it's like, man, I wish I was an alcoholic right now. And all this would be gone. But there's the nurse assistance program through most of the
Right.
boards. So
Definitely
that
do that.
is different, you go through, as long as you follow through with compliance with those programs. And I can't say for every state, but for most states, there's no public discipline process.
Right.
It's the public discipline process that makes it really hard for
Yeah.
people to move forward.
And maybe that's something we should think through as a profession.
Yes,
We did that with drug and alcohol programs because
Yes.
we knew diversion was a problem. People wouldn't
Yes.
report. We wanted a safe space to help people get well.
yes, yes.
And so in a world where late fees or forgetting or checking the wrong box, maybe we as a profession need to go back
And I
look
think
at what
it's
has
time.
happened.
I spoke in front of the Senate last month on this topic. I spoke in front of the Kansas State Board of Nursing asking for a diversion process. Almost all other licensed professionals in Kansas have a diversion process, but the
Oh.
Board of Nursing doesn't. Now, in
Interesting.
other states, they may have a diversion
Okay.
process.
Yes.
So,
statewide.
people need to see state by state, but then we need to be an advocate. And I signed up to serve on the Board of Nursing when there's another opening. I don't know if they'll take me. But, we need to be in those positions.
Yeah.
If we have reasonable people in those positions that can help drive this, that's important. So we need to volunteer into those leadership spaces so that we can protect our profession and protect patients.
Yes, I love that. We need a diversity of thought in the room. in
Yes,
Those things as well.
yes.
The other thing I think that's really important to come out of this is we have so many people that listen to the podcast who are nurse leaders or are
Yes.
employers. And so I think it's really important when you pull those license on people to have a conversation. Tell me a
Yes.
little bit about what this thing is.
Right.
And
Right.
9 times out of 10, I'm sure when someone comes through and goes, here's exactly what happened, I can
Right.
walk you through whatever.
And they should have the paperwork to show it to validate.
Correct.
Yes.
Right. And so as nurses supporting each other in hiring and in professional practice, I think that's just as important. Yeah.
Right. I want high standards. I definitely want high standards for nurses and nurse practitioners. We also need a level of reasonableness,
Mhm.
and because this is going to affect access to care as
Oh,
well.
100%. Yeah.
Right.
And there's a lot of us when there's 4 million and we have to kind of protect each other, but of
Right.
course, protect the public
Yes, that's important. So important.
without being dogmatic.
Yes.
Really.
Yes.
I appreciate you talking to us.
Sure. It's
Besides knowing your Nurse Practice Act, carrying your malpractice insurance, and being guarded in your responses, is there any other big take homes you think people need to think about?
I kind of like what you alluded to, is that we need to surround ourselves with supported people. You know, when you face a public shaming process like this, that is hard.
Mhm.
And it's hard to not let that define you, because a lot of us, you know, if I said, you know, who are you? And you'd say, I'm a nurse practitioner. I mean, you almost
Right.
define yourself by what you do. And so if you
Exactly
define
what
yourself by
not
what
what
you
you
do,
said.
and then somebody threatens to take your profession away from you, who are you?
Right.
So it is important that we recognize our identity cannot just be tied up in what we do, and it doesn't define our value and worth. And we need to find a path moving forward. So finding a support network, people around you that can encourage you, because there are going to be times where it gets hard. It gets hard, and, you know, just self-doubt and just that can be a hard place, but we need a good community around us.
Yeah, I love that you emphasize that this does not define you.
Right.
Yeah, I don't
Yes.
think we say that enough.
Yes. We need our friends of NPACE community.
We do have friends of NPACE.
Yes.
And such an important topic. We talk about a lot of clinical topics here.
Mhm.
But this license, without it, the rest of it is
I know you can't do
for
anything.
naught,
Right.
right? I
Right.
appreciate you being here.
Oh,
All right,
pleasure.
if people want to find you, where can
Yes.
they find you at?
amysiple.com.
Okay.
Just amysiple.com.
Perfect.
Yes. And reach out to me if you're facing a tough case and you just want someone to talk to. I'd be happy to talk to you.
Oh, I appreciate that. so
Yes.
much. Thank you.
Yes.
Amy was here with us in Chicago. She did talk on leadership and communication, and that was just a beautiful presentation.
Thank you.
And then we did an update on medications. and
Psychotropic stewardship.
It was
Yes.
very good. So
Thanks.
you can find all of those. We're going to put them online probably in the next 90 days. So you can find them at learn.npace.org on demand. But you're also a fantastic speaker
Thank you.
and a fantastic nurse practitioner
Oh,
who's supported
thank
the profession. So we're honored to have you here
It's
with us.
my pleasure.
Thank you. All right, so we're going to sign off for now, but be sure to check out all things NPACE at npace.org. We are an ANCC accredited provider of continuing education, and stay tuned for the next episode of the Friends of NPACE podcast.